If you're not getting a good night's sleep, then stay tuned for Being Well. My guest this week is Rachelle Hendrickson from the Sleep Disorder Center at Sarah Bush Lincoln Health System. We'll learn more about the most common types of sleep disorders like sleep apnea and restless leg syndrome. Rachelle will also give us some helpful tips on how to get a good night's sleep. That's just ahead on Being Well, so don't go away or go to sleep. Well, today we're talking about a topic that we can all relate to, and that's sleep or lack thereof sometimes. Talk about what is the recommended amount of hours of sleep for the average adult?
The average adult should get around 7 to 9 hours of sleep, but of course everyone's different. Some people need more, some people need less.
And how do you know if you're not getting enough sleep? That might sound like an obvious question, but...
Usually, in order to tell if you're not getting enough sleep, it's how you feel the next day. So if you wake up feeling refreshed, if you feel like you're functioning very well throughout the day, if you don't have to nap during the day, then you're getting enough sleep. So if you're a person that's waking up very groggy, you're having a hard time functioning, you feel like you have to have a nap, then that means that you need to get more sleep at night.
Okay, is there any reason why some people can function just fine on 4 hours of sleep and people like me need 8?
There's really no real answer to that. Yeah, everyone's different. That's the main reason, with the amount of sleep that people get.
Let's talk about some of the side effects if you're not getting enough sleep. There's a lot of things that sleep does for the body. Let's start with that. What does sleeping do for the body?
Well, sleeping, of course, improves your memory and mood. Sleep will also just naturally enhance the functioning of your body. All the body systems work according to how much sleep you get. Your hormones are affected by sleep. Also, that too can cause a lot of different body problems such as diabetes, weight gain, obesity if you're not getting enough sleep.
Can you explain the obesity, lack of sleep connection? Because that's an interesting...
Weight gain and obesity can occur if you're not getting enough sleep due to the hormone leptin is produced whenever you're sleeping. And the hormone leptin is the hormone that makes us feel full whenever we eat. So if you're sleep deprived, that hormone will start to level off, it'll drop off. And that dropping off will cause us to eat more and also choose more unhealthier foods.
Okay, so sleep is a lot more than just, getting rest. It sort of restores the body and gets you ready for the next day, and it prevents us from gaining weight.
Right.
Talk about, before we get into more of the sleep disorders, what are some things that you would recommend that we do to help get just a general good night's sleep? You probably see people doing some things that are not helping their sleep.
Correct. The best thing to do is to always try to maintain your 7 to 9 hours of sleep every night. Try to maintain the same wake and sleep schedule. So that means, go to bed the same time every night, wake up the same time every morning, no matter what. Always do that every day and night. You also want to try to maintain the same relaxing bedtime routine, such as maybe take a nice warm bath before you go to sleep, read a book, maybe relax and listen to some soft music. However, you do not want to sleep with the TV or music on, and that's because they both will produce sound, and that sound actually changes throughout time. So the changing of the frequency of sound will actually arouse the brain to wake up. Same way with the TV with the light. The light changing will cause the brain to arouse, and it will make the brain think that it's daytime, so it needs to wake up. So that's why it's bad to sleep with the TV or music on. Now, if you're someone that needs to have noise when you sleep, it's okay to have a fan on or a white noise machine. And that's because the sound stays constant, so it won't wake you up.
Okay, and what are the recommendations for caffeine?
You should stay away from caffeine, alcohol, and nicotine in the late afternoon, evening hours, just because they're a stimulant. They will wake you up, they'll keep you awake, and then also what will happen is some people, they feel like they can fall asleep immediately after drinking a cup of coffee, but what will happen is like 2 or 3 hours later, that caffeine will kick back in and it'll wake up the brain.
Okay.
Another thing to try to do in order to maintain sleep is to exercise daily. Try to get exercise in around 3 hours before bedtime. They have found that people who exercise 3 hours before bedtime actually enhances their sleep. And that's because whenever you exercise, your body temperature increases. So when you quit exercising, the body temperature will actually fall. And that falling of your body temperature actually is what enhances the sleep.
Okay.
And whenever you are ready to go to sleep, that's what happens, is your body temperature is at its lowest. So that's why it's ready for sleep.
Okay.
So along with that, that's why you need to keep your bedroom cool, dark, and comfortable, because a cool bedroom will help you enhance sleep because that way your body temperature stays lower. The room needs to be dark because the light, of course, will arouse the brain, make you think that it's daytime. And then, of course, you need a nice, comfortable bed in order for your body to relax enough to be able to sleep.
Right. And that, we were chatting this before we taped the show. Why do a lot of us get tired at about 2 o'clock in the afternoon?
A lot of times at 2 o'clock in the afternoon, that's when your body temperature will start to drop off again. So that's what will enhance the sleep.
Okay.
So that's why at 2 o'clock, it's probably a good time to go out and get some exercise to get your body temperature back up. Maybe do a nice little walk. Maybe not do your full exercise routine at that time. Just go out, get a walk, maybe eat an apple, a crunch. Eating something that crunches actually arouses the brain to stay awake too. So that's good things to do around 2. If you're someone that then needs to be able to, enhance sleep, then of course you want to exercise then the 3 hours before bedtime.
And you said that same phenomena happens to people who work a night shift. They get that around 2 a.m.
2 a.m., yes.
Okay.
Same thing happens around 2 a.m. Their body temperature starts to drop off, so they get a little tired around that time too.
Okay. So as we start talking, that's general sleep. A lot of people have sleep disorders. Talk about the most common types of disorders that you see.
The main ones is sleep apnea, insomnia, and restless leg syndrome.
Okay, let's go through all these and kind of give us an explanation of what they are and some of the symptoms.
Sleep apnea, of course, that's what happens whenever your airway becomes blocked due to excessive tissue in the airway, such as enlarged tonsils and enlarged uvula, or sometimes the tongue will slip back into the airway and block it. Another reason for a blockage is that your airway will just collapse, and that's due to the muscles in your throat getting nice and relaxed whenever you fall asleep. That blockage will then cause snoring or the gasping for breath or the stopping and breathing. Now when that happens, your oxygen levels will drop off, which will send a signal to the brain to make the brain try to arouse the body in order to wake up and start breathing again. So whenever you have that stopping and breathing, that's what an apnea is. And an apnea can occur for about 10 to 60 seconds at a time or more, and it can occur up to 40 times or more per hour.
Wow.
Yes.
So if you think you have sleep apnea, what are some of the symptoms of that?
The main thing is excessive daytime sleepiness. So if you're having a really hard time functioning throughout the day, you're really tired, if you notice that you're snoring, gasping for breath, or even stopping breathing at night. However, some people don't realize that they're doing that stuff during the night, and what they are told is by their bed partner.
Right.
Hey, you are snoring really bad, or I've noticed that you quit breathing so many times in the night. Then that means you probably need to go get checked out because you probably have sleep apnea.
Okay. And the sleep apnea, is that something you can die from?
Yes.
And just quit breathing altogether?
If you keep going with having the sleep apnea, it'll just keep getting more and more severe as you age, because as we age, the tissues in our throat get more relaxed. Same way if you become overweight, which like I said earlier, if you don't get enough sleep, that can actually cause you to gain even more weight. So those people will just keep getting even more excess tissues in the airway to block. And what will happen is if you're not getting enough oxygen to your heart and your brain, that will end up causing a heart attack and stroke, which will then lead to death.
It's a pretty serious case.
Yes.
Are men more susceptible?
Yes.
You see more men with sleep apnea?
And it's mainly because they usually have the bigger necks. So that's what's causing the airway to collapse more, is because men have large necks.
And being overweight is another risk factor.
So that's why we're starting to see more women with sleep apnea, is because of being overweight.
Okay. And just because you snore doesn't necessarily mean you have sleep. Some people are just snorers.
Yeah, but there is usually saying there's some sort of obstruction going on.
Okay.
Yeah.
Okay. Let's talk about insomnia.
Insomnia, there's 3 categories of insomnia. What happens with insomnia is that the first category, second category, everyone has had some point in their life. Everyone experiences insomnia at some point in their time. Transient insomnia, that's when you only experience insomnia symptoms for less than 1 week. Acute insomnia, that's when you experience insomnia for 1 to 3 weeks. And these typically occur due to something that's just recently happened. So you're studying for a test or you have an important job interview coming up. Those are something that's stressing you out, causing you to have difficulty falling asleep or maintaining sleep. Those two you really don't have to typically worry about because like I said, it's only occurring just for a short period of time. Now, when you need to worry about insomnia is when it's more chronic, when it's lasting for longer than 3 weeks at a time. That's when you need to contact your doctor, get a sleep study schedule to see what's causing the insomnia.
And insomnia is just you don't sleep at all, or maybe it's is it categorized by so many hours of sleep a night, or how do you say you have insomnia?
They really don't have a category for how long. It's just people that complain that they're having a hard time falling asleep, they're maybe waking up too frequently throughout the night, or they're just having a hard time once they wake up in the middle of the night, they then have a hard time going back to sleep.
So a symptom of that would be you're sleeping and you keep waking up and suddenly, and like a slight panic, and then you fall back asleep. That could be
insomnia. However, that type of problem that's occurring throughout the night, that could be due to sleep apnea. So that's why doctors like to get a sleep study done to see if it's something else that's causing the insomnia.
And then the last one you brought up is restless legs. That's something we probably never heard about 10 years ago.
Correct.
And why? Explain what that is.
Restless legs is just where you have an unpleasant, tingling, creeping feeling or nervousness in the legs, and it happens during inactivity or sleep, and you have an uncontrollable urge to move your legs in order to relieve those symptoms. And so because you're constantly moving your legs or even kicking your legs at night, that's causing you to have some sleep deprivation. So you feel like you're excessively tired during the day. Restless legs can be genetic or it can be caused by a medical condition such as deficient in iron. A lot of people also have restless legs due to having too much nicotine or caffeine because they're stimulants, and that stimulants just constantly keeping the legs active. So people that are have the restless legs due to nicotine or caffeine, the doctor of course tells them to quit that, see if that will make the symptoms go away. Otherwise, if that doesn't help, then what they do is they come in for a sleep study to see if there's some other reason that's causing the legs to jerk at night. We've seen that some people have sleep apnea that's causing the legs to jerk after they have an apnea in order to wake themselves up to start breathing again. So of course those people can just get put on CPAP in order to control it. Now if they are just constantly jerking their legs at night, then they just have true restless legs, and then they're just get put on some sort of medication in order to help control the symptoms.
Is it usually like a muscle relaxant kind of medication?
Yes.
Yeah. You mentioned CPAP, and we should have talked about this. If you are diagnosed with a sleep apnea, that's the treatment for it, correct?
That's the most known treatment that tends to work the best for everyone is CPAP.
And what is that exactly?
What it is, it's just a machine that's going to continuously force room air down into your airway to keep the airway open. Because like I said, with sleep apnea, the airway collapses or the tissues block the airway. So with the CPAP forcing that room air in, it will open up the airway and keep it open. So it kind of acts like a splint of the airway. You wear a mask over your nose, or even there's masks out there that cover the nose and the mouth, and that will be attached with a hose to the CPAP machine. And like I said, it doesn't produce oxygen, it's just forcing room air into the airway.
And is that really the only treatment for sleep apnea?
No, there's also surgery. And surgery is just mainly if you're a good candidate for it. An ENT doctor, ear, nose, and throat doctor would have to look in the person's throat to see what type of excessive tissue they have, if they'd be able to remove it. Some people just aren't candidates for the surgery at all. And of course, insurance likes for people to try CPAP before they even try surgery. So if CPAP works, they tell them not to go for the surgery.
And generally in your line of work, does the CPAP machine seem to be pretty effective for most people?
I would say like 85–90% of people do perfectly fine on the CPAP machine.
Let's talk a little bit about sleep aids and how they really work. Talk about some over-the-counter things. What does that do?
Sleep techs Personally, we do not like sleep aids,
Okay.
mainly because sleep aids will make a person not really go into their deeper stages of sleep. I mean, you can still, but they tend to just try to put you to sleep, and they just let you maintain your lighter stages of sleep. Now, the main problem with sleep aids is that if you have sleep apnea, your sleep apnea will be even more severe with sleep
Okay.
aids. And that's because sleep aids relax the muscles of your throat even further than what they would normally do. So that relaxing of your tissues in your throat is collapsing the airway even more, therefore
Okay.
causing you to have even more severe apneas.
So when you take a sleep aid, does that mean you're not going into that deep sleep, the REM sleep?
Right.
Okay.
Yeah, it can. Like I said, some people will still have, their deep stages of sleep, but it probably won't be occurring as often as it should throughout the night.
So Rachelle, I should ask, why is REM sleep so important to our body? Why do we need that?
REM sleep is when the memory consolidates itself. That's when the brain will kind of repair itself. So that's why REM sleep is very important.
Okay. And you, as you said before, you don't get into REM sleep if you take a lot of sleep aids.
Yes.
Okay. So are prescription sleep aids just a stronger version of what you can get over the counter?
Correct.
They kind of do the same thing.
Yes.
So I do know some people that, if they can't sleep, they'll take a swig of cold medicine. That does not have a sleep aid in it. That's just alcohol, probably.
Yeah, it's the alcohol that's in cold medicine that will do that to people. But
Okay.
yeah, you shouldn't take that either.
It's a temporary
Right.
kind of fix.
Yeah.
Do you find that sometimes people can't get to sleep because they're thinking too much about trying to get to sleep?
Yes, that's an insomnia issue. So that's why
Yeah.
we try to tell people, if you're having that problem, try to get out of bed for a while, do something else, maybe do some light reading or listen to some soft
Rather
music.
than lay there.
Right. If you lay there and stress about it, you're just going to stress about it even more.
Let's talk a little about, as we get older, my mom has said, I used to be able to sleep so well, and as I've gotten older, I just, I don't sleep that long. What are some of the reasons that make us not sleep quite as good or as long the older we get?
The older we get, of course, we deal with arthritis and just general muscle aches and pains. So because of the pains and the muscle aches, that will cause the person to wake up throughout the night. Another thing is a lot of older people just don't realize that they have sleep apnea. Sleep apnea occurs even more as we age, just because the tissues get more relaxed and they cause the airway to block off. So because of that, that'll cause the person to wake up a lot. And so a lot of older people, if they find themselves laying there awake for a little bit, then that's why they just get up and go ahead and get out of bed.
Let's talk about younger people. What's the recommendation for kids? I know we'll talk about infants, kids, teenagers, recommended numbers of hours of sleep for those different age groups.
Infants, they recommend like 16 to 18 hours of sleep. Children, like toddlers up to like 10 years old, they should get anywhere from like 12 to 16 hours of sleep. Now of course, the little toddlers, they're going to be closer to the 14, 16 hours
Right.
of sleep. And then as you age a little bit more, it's more the 12 to 14. And then teenagers, they need around 8 to about the 12 hours of sleep.
Okay.
Now, once they hit more of like the adult version of teenagers, like once they hit around 16, then they can do more of the adult sleeping of 7 to 9 hours of sleep.
But that's usually the population that sleeps till noon.
Exactly.
Which brings me to my next question. Is oversleeping and getting too much sleep, you'd think, oh, that should be a good thing. Is it?
No, it's not a good thing. You need to try to maintain more of the 7 to 9 hours of sleep. Now, if you need a little bit more, that's fine, like the 10 hours, but especially teenagers that will tend to sleep normal during the week. They'll have a normal bedtime routine, but then on the weekends, they're going to bed around 12, 1 o'clock in the morning and not waking up till noon the next day. They're sleeping longer, usually because they're not sticking with that same bedtime routine.
Right.
So that's what will make them oversleep. And so that's why you need to stick with the same wake and sleep schedule.
What does having too much sleep? That can be not a good thing either in general. That sort of affects your sleep later.
It can, yeah. It can cause some insomnia issues the next night.
So in other words, I was going to ask, you can't make up sleep, can you?
Correct. No. You cannot make
I
up sleep.
try, but it just doesn't work.
Yep. It's okay to maybe take a nap, but then you have to worry that sometimes the nap can actually affect your sleeping that following night as well.
Okay, that's my last question. Let's talk about the naps. What you recommend and When is a nap good? When is it not?
A nap is good as long as you stick to less than 30 minutes at a
Okay.
time. And that's mainly because if you sleep longer than that, you're going to go into your deeper stages of sleep, which is just going to make you feel more groggy, because then if you don't end up getting the full 8 hours of sleep, your body's just not going to go through the sleep stages like it should.
Okay.
So if you let yourself sleep too long, like I said, you're going to fall in the deeper stages of sleep, get too groggy. Now, if napping can be harmful, if you are finding it's hard to fall asleep at night, or if you're having a difficult time maintaining sleep at night, then if you're one of those people, you just need to completely avoid naps altogether.
Okay. All right. So you've mentioned several times, getting a sleep study. When should you go to your doctor?
If you notice that you're having symptoms for longer than 3 weeks. However, if you already notice that you're snoring, gasping for breath, stopping breathing, then you already have a problem. You need to go see your doctor immediately.
And most likely he or she is going to say, head to a sleep center.
Correct.
Which we're going to take you to in just a minute to find out what happens when you go to a sleep clinic. Give us a little preview of what sort of the process is before we see it.
What happens when a person enters a sleep lab, they come in, they go through some paperwork, go through a little bit of their history with the sleep technician. After that, the technician then sits the patient down and hooks them up. You're pretty much hooked up from your head down to your legs. The wires on your head measure any sleep stages that you're in. You're going to have some wires by your eyes so they can see the eyes move. That way they can tell if you're dreaming, if you're going through that rapid eye movement. You're going to have some wires on your chin to see if you grind your teeth. You're going to have some sensors underneath your nose to see if you quit breathing at all. A microphone in your throat to see if you snore or talk in your sleep. You're going to have sensors on your chest for heart rate and heart rhythm. Belts across your chest and stomach to see if you quit breathing also. And then you're going to have some sensors on each leg to see if you jerk your legs. That way you can tell if you have restless legs or not. And then an oxygen probe on your finger to measure the oxygen saturation in your blood. So they'll hook those sensors up. Takes like a good 45 minutes to do so. And then around 10 o'clock is when we do lights out, when people go to bed. They go through some little exercises with the patient just to make sure all the equipment works fine. And then the person's just asleep all night. And then they typically wake them up around 5:30, 6 o'clock in the morning.
All right. Well, stay tuned. We're going to head out to the Sarah Bush Lincoln Sleep Center in just a bit. So don't go away. There's more Being Well right after this. Check out all the episodes as well as demonstration segments from the Being Well series. Visit us on youtube.com/WEIU-TV. For an inside look at what happens during a sleep study, we headed to the Sleep Disorder Center at Sarah Bush Lincoln Health System.
Whenever you get here, we'll go through some paperwork. You can ask any questions then whatever you need to know. We'll go through all the paperwork, have you change, get into whatever you're going to be wearing. Then I'll come back in, start hooking you up. That'll take about, depending on your tech, about 30 to 45 minutes. After that, you're free to sit around, watch TV, do whatever you want. And then we put you to bed around anywhere from 9 o'clock to 10 o'clock.
25 different sensors are placed on the head, chest, and legs. The sensors send information to the techs in the monitor room, with the results being analyzed the next day.
We'll run the study from the tech room. We'll see, we watch to see whenever you're sleeping, not sleeping, if you're not breathing. We count up your events. If you've met enough events for the night, then we will come in, put a CPAP machine on you. If you've stopped breathing a severe amount of times, we'll do that all in the same night. Otherwise, we just let you sleep the whole night and watch what you do.
Caregivers or family members who need to spend the night can do so in a separate room. If you've got a sleep study scheduled, here are a few things that you should do before you arrive.
Make sure you don't have any kind of lotions on you, that sort of thing, just because our sensors won't stick very well to lotion. So definitely shower, make sure your hair is clean, no oily hair, because the sensors will slide right out of that. So, and yes, definitely wear loose-fitting clothing.
With the study complete and the results analyzed, hopefully you'll be on your way to a better night's sleep. Thanks for watching this edition of Being Well. We'll see you next time.